Hey guys, my name is Ibreez and I currently work as a doctor in the NHS. In this video, I'm going to be discussing my experience as a patient in the NHS. If this is the first time you're checking out our channel, welcome. Basically what we do is we run a website that's totally free known as roadtok.com, and it will explain the ins and outs about everything related to the United Kingdom and what it takes for you to work as a doctor in the NHS. So if you've not already, please stalk us on all of our social media. Find us on Facebook, find us on Twitter, Instagram, and of course, YouTube. Don't forget to subscribe. So I'm not only going to be talking about my experience as a doctor being a patient in the NHS, but I'll also be talking about my experience as an American coming from a healthcare system where you pay for everything and coming into and experiencing the NHS where there's universal healthcare free of cost. So stay tuned to know how much it would have cost me in the United States compared to how much it cost me in the United Kingdom.
These are their stories.
So picture the perfect spring day, alright? The sun is out, there are no clouds in the sky, the weather is absolutely beautiful, and you've just finished your night shift, and you're like, I don't want to waste this day sleeping. I want to do something better. So that's what I was doing. I was telling myself, let me be that person who is actually trying to get ahead and do some stuff on their day off. And I go out and about, trying to have a little bit of fun, make a little bit of a difference, and naturally it's on one of those days really that's when all the worst could potentially happen. And so basically what happened with me was just going about the normal everyday humdrum when my legs decided, do you know what, why should we listen to the rest of the body anymore? My right leg decided to go in one direction, my left leg decided to go in another direction, while the rest of me of course was pointed a completely different way. And that was basically it. I felt this really bad pop in my leg, in my left leg, and I just kind of collapsed to the ground. And I thought, this is just a minor fall, because I do fall a lot. I'm not very stable on my feet as is. And I thought, that's it, it'll pass. It's not going to be anything too terrible. So I sat for a second, and I was just like, alright, doctor mode. Let me see what's happening. Can I feel everything? Yes. Can I move some stuff? Kind of, but it's pretty painful. Should I try and stabilize the knee a little bit further? Looking around, not really an option. Let me see if I can straighten my leg. Terrible idea. So now the question becomes, what really are my options here? What should I do? I decided to wait for a little bit, that maybe the pain would pass and it would be fine. Because sometimes, when you sprain your ankle or you do something too extreme, you just need to take a couple of breaths and that all kind of passes. So I sat there for a second, and again, just going through my general assessments again. Could I feel everything? There were no pins and needles. Did it look like I had cut anything, or did anything look misshapen or too swollen? And everything looked all right. So when I tried again to stand up, I realized I could not weight bear at all. And it was very, very painful, to the point where I was like, do you know what? I think I need to call someone about this. Initially, I was pretty reluctant to do that because as an American, you don't want to go to the hospital. Healthcare is crazy expensive, and you don't want to even think for a second how much bill you'll be racking up if it's something as simple as just a sprain or a twisted knee. But then, thankfully, I do work in the United Kingdom, and the NHS provides fantastic healthcare at no cost. So what I did first was I called 111. So for those of you who don't know, 111 is a 24-hour, 7 days a week number that you can call for urgent medical advice. If you're in a situation where you're like, something's gone wrong, but I don't know what to do next, 111 is who you should call. I got patched through to someone who basically asked my general information and was like, alright, what's going on? So I explained to them what had happened, and they thought it was appropriate for me to speak to a GP. So I just waited for a little bit, they transferred my call to a GP, and we went through the rigmarole again. What happened? How do you feel? Can you do this? Can you do that? Is the pain here? Is the pain there? So the GP, asked me to do a couple more things, and I was starting to realize, do you know what, I really cannot do that much, and it's too painful, and I didn't want to risk trying to do something that could potentially worsen what had already happened. So what the individual on the phone then recommended I do was just wait where I was, because the best part of this situation, or perhaps the most ridiculous part of the situation, was I was in a place where I would not be able to get out on my own, so I would need an ambulance to come and get me. So because of that, the GP recommended I stay exactly where I was at and they would send an ambulance my way. So I hung up the phone with 111, waiting for the ambulance. I just look over at Ibrahim and he's just kind of like, what have you done? And really, I know it was bad because it was our days off. You know, we had a stretch of time off together, and it's nice to be able to do something different rather than the everyday kind of boring stuff. But it is what it is sometimes. So we just kind of sat there waiting for the ambulance to come. They came fairly quickly. Ibrahim pointed them in my direction, and we did the whole assessment again. And because this was at the height of COVID, the poor ambulance team, I felt so bad for them, were in full-on PPE. I explained to them that I'd been sitting in the sun for some time, which was why I was really warm, and that I had none of the symptoms to, suggest that I was infected with COVID-19, and they did a generalized assessment. So by that time, my knee had gotten a little bit swollen, but it still wasn't anything too bad, and there weren't any bruises or anything that, deformity-wise. I was able to feel everything, and I could wiggle my toes and kind of do the general basic stuff, but I still could not weight bear. So we had to now figure out how I would get into an ambulance, especially because I could not weight bear. The difficult part really was not just the standing, because when I would stand, I could lean onto something, but to actually progress, it's not like I could just be carried from where I was into the ambulance, especially because that would have just made me even more ungainly, because I just can't ever find balance in my life whenever I'm trying to do normal things, so imagine trying to do something like that. What they had to do then, they suggested I take some pain relief. Now, I'm fine with really basic pain relief, but I don't really do too well with anything too much stronger than that. Usually I just kind of feel sick. And this was not an exception. So they gave me some nitrous, and oh my gosh, if any of y'all have ever had nitrous, it is yuck. Like, I felt so weird. My head felt like I was in a fog, and my ears were all cloudy, and I felt like when I was trying to say something, it wasn't me. It was like I was talking through like foam or something. And then on top of that, I felt like I wasn't actually there. Like I was there physically, but I felt like I wasn't actually experiencing the situation that was actually happening right then and there. Like maybe it was some sort of bizarre dream. But it at least gave me enough relief that I was able to, with the help of Ibrahim, hobble over to the ambulance and get in. And unfortunately, Ibrahim couldn't come with me because of all the COVID restrictions, and all I took with me was basically just general ID and a credit card to try and find a way home, because I wouldn't be able to obviously take the ambulance back home. But I didn't have to worry about, anything else like an insurance card or any other kind of extraneous costs associated with this. And the ambulance guys buckled me in to the nifty little chair that they had. We went over some more just general information about me and what they would need to hand over to ED. And then they drove to my hospital. Oh my gosh, it's just like, I just left. I literally just left work. And all I could think was how embarrassing it would be if somebody recognized me, because then I'd have to go through this story and they would just be like, Ibreez, can you not even walk? So the wonderful ambulance staff got me into a wheelchair and wheeled me into ED. And all I could think to myself was, oh my gosh, if someone recognizes me, what am I gonna do? So they got me checked in. I told the receptionist all of my information, and I was triaged. So I was called in and wheeled in basically to see a nurse who understood what was going on, wrote it all down on a piece of paper, and put that file together and said that somebody would be seeing me shortly. So I want to say I waited probably about 15 or 20 minutes or so. And I was pulled into an area of our hospital's ED, which is known as minors. So most hospitals will have minors part of ED and a majors part of ED. So minors are usually, like minor injuries, and they aren't usually, individuals that they expect will be admitted into the hospital. And majors will be somebody who's a little bit more ill and would likely warrant admission into the hospital. So different EDs have different, setups. Some parts are even just a total, really small minor injuries for scrapes and bumps and bruises. And then of course, there might be even a pediatric emergency department. So I was taken to the minors ED, and I was seen by an advanced nurse care practitioner, and she basically helped me get back on, and she helped me get onto the examining bed, which was a trick in itself because it was just so painful. All the pain had basically come back at that point. So the first thing she did after introducing herself and basically explaining, what she was hoping to do today with me, she got me some pain relief. So I tried to, prop myself up as best as I could given my situation, and she did a once over of my leg, tried to make me do some basic exercises like raising my leg and move it around. Thankfully, I was still, able to feel everything. There wasn't any issue with that, but my leg was considerably swollen at this point, or basically my knee. So she was a little concerned that there was a chance maybe that I had fractured something. So I was wheeled in to get an x-ray of my knee done. So the porters came, took me down to the x-ray department, which wasn't too far away from ED. And then I was seen by the x-ray technician, and she was literally the nicest person in the world. The best part was, because it was like, a chill day off, I was wearing my Pokemon t-shirt. And my Pokemon t-shirt has Pikachu on it. So the x-ray tech was a Bulbasaur fan, not a Pikachu fan, but she did not hold it against me, thankfully. And she was very sweet and considerate, because it was really painful for me to manipulate my knee in the angles that I needed to keep it in for the scan. But she was really good about it, got some pillows to help me, at least kind of keep it in a way that it wasn't too painful, and we got my x-rays done. Got back to ED, and the advanced nurse practitioner came back to see me, said it didn't look like there was any sort of a fracture, but she still didn't feel happy about sending me home because I was still struggling to weight bear. So what she did was she put in a call for the orthopedic registrar to come and see me. So after a little bit, the orthopedic reg came and saw me. He did the same, works again, looked at the knee, and he basically said, well, there's a chance it could be just a really bad sprain, but there's a chance that you may have torn something. So they didn't want to obviously just rule out a tear without actually getting a scan done. Because it was COVID, a lot of the normal functions of what was happening in the hospital were not running because we were at, trying to do things at minimum capacity to minimize the amount of people inside the hospital. So they said, let's do one thing. Let's try and get you a little bit of basic physiotherapy, treat it as a really bad sprain, put it in a brace, get you some rest, the basic rice stuff that we talk about in the FLAP 2 examinations. So rest, ice, compression, and elevate, and then see where we're at, and after that, depending on how I feel, we would go ahead and book the MRI. And I thought that sounded like a pretty fair plan. They spoke to the orthopedic consultant as well, and they agreed to everything. Now came the awkward part when they were like, so what do you do for a living? So I was just kind of like, well, you've asked it, now I have to tell you that I am a doctor. They're like, oh, fantastic, do you work in this hospital? Yes, in fact, I've just been redeployed to ICU to deal with, COVID. Now I just felt like a horrible person because there I was in the middle of a huge pandemic, not able to do anything to help because I had basically gone and injured myself to the point where I was not able to stand. And the biggest thing was with that, even if I was able to weight bear with, let's say, a crutch, going into a COVID area with a crutch is not something that's really feasible or anything that would really make sense. So the way the system works in the NHS, you can take 7 days as your own, sick leave and say that you are self-certifying yourself, that you are unable to come in given whatever reasons. And that's what the orthopedic registrar suggested that I do, self-certify for 7 days and then see how I feel. And they would have a consultant call me in between to see if there's anything else that needed doing. And I would also speak to one of the orthopedic physiotherapists to see what they would suggest about how I could strengthen my knee and get about to going, how I usually do my things. So they put my knee into a brace. They helped me get some crutches that were to my size, and I was more ungainly on those crutches. They were elbow crutches at that. But the poor ANP, she was very nice. She helped me, learn how to stabilize. Physiotherapist came and made sure I knew how to put my foot forward and basically walk through the crutch. And I called for a taxi. Taxi took me home, and Ibreez was waiting for me. The poor guy was, waiting basically the entire day because it took a couple of hours to get all the scans and everything done and set away. And I kind of hobbled back into the house thinking, well, how long is it going to be before I can do my normal things again? So in that 1 week of rest, which was torture, by the way, because I was basically confined to a sofa, I tried to not do too much to give my knee the opportunity to fix itself. The orthopedic consultant spoke to me and also kind of gave the same general advice. Let's just see how things look by the end of the week. By the end of the week, however, I still wasn't able to weight bear, so I spoke to them again and they suggested I take 4 weeks off to really give it a full opportunity to recover, because I still, even when I was trying to put my foot down, I would get this sharp jolt of pain that would come up to the side of my leg. So they gave me a fit note for those 4 weeks, and slowly, with the help of physiotherapy, I was talking to them as well. In between all of this, they helped me kind of get to the point where I didn't need the crutch anymore. And that was a really slow and painful process. I think it took me a little more than 2 weeks before I could actually just walk around confidently without it. And still, there was a little bit of me feeling unsteady if there was a hill or any sort of an incline or even stairs. So after those 4 weeks were done, and thankfully all of that was paid leave, I came back to work and I was trying to see how much I could do and couldn't do, but it became pretty evident that my knee was not where it should have been. It wasn't 100% the knee that I had had before all of this had happened. I felt like it was still a little bit swollen, and it got really swollen if I tried to do any sort of exercise. And then on top of that, it didn't feel right, if that makes sense, and I couldn't straighten it as well as I would have liked to. It felt like there was something there that wasn't allowing my knee to do what it needed to do. So after I discussed this with the team, they suggested, do you know what, let's go ahead and get that MRI of your knee done. So as luck would have it, I was finishing a night shift that day as well, and I went down to our MRI department where the techs were super nice, and they have this really cute little donut for your knee. It's like, I've never seen an MRI just for the knee. So it was the nicest little thing, and I basically told the tech, you know what, I'm just coming off of a night shift and I'm exhausted, so I may fall asleep during this scan, because she said it might take about half an hour to 45 minutes, and she was so chill about it. She gave me a pillow and a blanket. She stabilized my knee so that my leg wouldn't move while I slept, and she was just like, go for it. So I am not ashamed to say I went to sleep for the full duration of that scan, and it was wonderful because the MRI kind of has that low hum. It was very soothing, and it was kind of warm as well. So I just went to sleep for the full duration of the scan. She was really nice. She woke me up, and that was it. I had the scan done, and they told me it might take a couple of days for them to know what the report was. So thankfully, I didn't have to wait too long to hear about the MRI result. But when the team called me, I think everyone knows where the story is going now. I needed to have surgery on my knee because I decided to go tear some stuff up. Apparently, I had managed to tear a ligament and a meniscus because I'm that awesome. And why do things if you're not going to do it all, right? So the issue was now trying to find a day that would be appropriate, that would work around my schedule, work around everything else, and obviously get it done as quickly as possible, because I wanted my knee to be fixed as fast as possible, and I wanted to be able to go back to doing what I was used to doing and not have to think about, well, how is this going to affect my knee in its current state. So I spoke with the physiotherapist, I spoke with the other members of the team, and they were like, okay, we're going to put you on an urgent list to get it done as soon as we can. And a date finally came up about, I want to say, about 4 to 6 weeks after that initial discussion about the MRI. So because it was still COVID-y times, I had to have a swab done, and then I had to self-isolate for that period of time, and Ibrahim had to as well because we live in the same household. So that was not fun. Oh my god, the COVID swab was just like, it was awful. I don't even know if any of y'all have had it, you will understand what I mean. Thankfully, I did not sneeze because I thought I really was gonna, and I felt bad because those people were there in the face mask and everything. Then for them to go in there and then you to sneeze all over them, but it was an experience that I really would not wish on my worst enemy, and it was not fun in the slightest. So I got that done after a shift, and then had to basically self-isolate until the day of the surgery. So the day of, I'd already gone through all my pre-surgical stuff. I had already gone and spoken to whoever I needed to speak to, and they'd done whatever workups they felt was appropriate. I go down to the hospital, and Ibrahim comes with me, but again, because of COVID, he wasn't allowed to go beyond the basic, reception area. So they have told me, of course, to come nil by mouth. Didn't have any breakfast or anything like that. and they've given me all my paperwork and said, okay, well, here's the room that you'll be staying in, and you're scheduled for this afternoon. So I was supposed to be a day case, which means that you just go and it's done that day, and then you go home, which was fine with me, because, like, who wants to be in the hospital? Nobody wants to be in the hospital. Even when you're working, you don't want to be in the hospital. So the nurse came in, and she gave me basically like a Hibby scrub, kind of like an antibacterial scrub. And she was like, you just take a quick shower, use a scrub. And they had a gown for me to put on, and I just put that on, and I just kind of sat there awkwardly looking out the window thinking, well, now what? Thankfully there was obviously there's Wi-Fi, and they had a TV, so I just tried to, flip through a couple of channels, but I really wasn't into that at that time. I was just like, I just want to get this all over with. I think the anxiety associated with all that is probably worse than the anxiety that I get for an exam, or like just public speaking or whatever. So the anesthesiologist came in a little bit before the procedure was to start, to talk me through the ins and outs of what would happen. I asked him if there was any way I could just be awake, because I really wanted to see everything that was happening. I think he was like, what in the world? But I mean, I don't think it's an unreasonable question. When you're in the medical field, you want to know what's happening. But he did say that he would try his best to explain every bit of the process as he could, and let me know what was happening as and when it was appropriate. So that was fine with me. And what they effectively decided upon was for me to be under GA, or general anesthesia, which was okay. I mean, you think, all right, well, you're just going to go to sleep and then you wake up, but you want to know what's happening in that in-between. At least I do, because I'm just curious to know what the entire process is like. But it's cool. So I was going in for a knee arthroscopy anyway. It's not like there was much I probably could have seen, but it would have been cool to just, I don't know, be able to see it. And just like, if you guys know about the story about that surgeon who did his own appendectomy, I mean, that must have been terrifying for him, but at the same time, how cool would that have been? So the time came for me to walk down to the OR, and they had the consultant there that I had been speaking with. There was a orthopedic registrar, there was a scrub nurse, and there was the anesthesiologist. Everybody was super nice. They explained what everything was, what the medications were, what they would be doing, and how they intended on doing it. They confirmed my identity and made sure they knew that I knew exactly what was happening, because I'd already been consented, but it was still a process to go through it all again. And then, of course, they had to make sure that it was on the correct leg, which they had marked, of course. So I got cannulated. They gave me a little bit of oxygen, and I think they gave me propofol. I want to say they gave me ketamine, but I'm probably wrong. Would that be right? They cannulated me, and they showed me what medications they'd be giving me. I had asked the anesthesiologist ahead of time that even if I didn't necessarily wear my full scarf, I have like, a scarf cap that was underneath, and if that was fine. And he was totally cool with that. He's like, that's fine, that's not going to create any issues, which was really great on their part. And basically the next thing I knew, I was waking up in recovery. I probably drove that recovery nurse insane, because I kept asking her everything, because I had an oxygen mask on my face, and I was like, is this oxygen? And I see in my cannula, there's a bag hanging up next to me, and I was like, is that normal saline? What time is it? Where are my glasses? Am I in recovery? What's exactly is happening right now? Did everything go fine? Am I done? And this lady must be like, well, she's obviously recovered enough. She doesn't need to be here anymore. But she just kept me there for a little bit to check my obs and everything. My observations were fine. And then I was taken back to my room, and they finally let me eat something. Oh my gosh, I was famished by that point, because it was like late evening, I want to say, by the time everything was said and done for. Because of the time everything got squared away, the physiotherapists couldn't see me that night, and they needed to see me before I could go home, because they had to put me in this special type of brace that allowed my knee to bend as and when they changed the gauge on it. So because of that, I ended up staying overnight, which, I mean, I was kind of 50-50 about, because you don't want to stay overnight in the hospital, but at the same time, it was like a really bizarre vacation. I felt really bad for Ibrahim, though, because I had basically abandoned him at home in this whole thing, and then he couldn't come up or do anything for me. But luckily, I guess, there was like a little bit of a window ledge from my room, so I just kind of like waved at him. And because I felt super nauseous and queasy after all that, because that's like the pain medication, I think the anesthesia really did not agree with me. He had come to the reception desk with some saltine crackers and some ginger ale, and the nurses brought it up, and it was really nice for me to at least be able to, eat some of those things and feel a little bit more settled. The pain wasn't too bad. They'd given me pretty adequate pain relief, and the reg had even mentioned that they'd put in as much local as they could to kind of minimize the pain. My leg was all bandaged up and in a compression bandage, and they'd asked me to leave it like that for a couple of days before I would take it out, and then before I would actually get the stitches removed. But that whole night, everyone was so chill. It was great. The nurses and the healthcare assistants, or the HCAs, were like, because they all knew that I normally worked in the hospital. They were like, just do whatever you want. You know, you can sleep whenever you want. You can watch TV all night. It's all right. If you need anything, just let us know. So, guys, there was Law and Order on TV. I don't think you understand the importance of me watching Law and Order.
In the criminal justice system, the people are represented by two separate yet equally important groups: the police who investigate crime and the district attorneys who prosecute the offenders. These are their stories.
So I probably stayed up till about 2 or 3 a.m. watching Law and Order. And the HCA checked on me periodically. You know, she brought me some herbal tea, some crackers every once in a while. Or we just sat and we just kind of like talked about stuff. I probably fell asleep around, I want to say around 3 or 4 a.m. And then come breakfast, they had some cereal and some toast, and I was just like, I need to get home now. This is too much. I can't deal with just laying in bed for all these hours. So the physiotherapist came in the morning, and she showed me the knee brace, and basically told me for the first 2 weeks I would have to keep my leg completely straight. Like, I could not bend it at all, and this brace would not let me bend it at all. And that not fun. I mean, I was just kind of like a little hobble monster. And so she got me another set of crutches and showed me basically how to walk around and use the stairs keeping one leg straight. And oh my gosh, I was just like, I'm gonna fall again. I'm gonna be back here and y'all are just gonna be like, Breeze, why are you so unable to walk like a normal person? So she was really great. She explained everything to me perfectly. And by the time I felt confident, she was like, that's fine, you know, we can get you on home. The SHO came by, said they had my discharge ready, and then I got myself back on home. So for those 2 weeks, I had to keep the knee straight. I spoke with physiotherapy. We were doing telephone appointments anyway because of COVID, and of course I couldn't really mobilize right now anyway. And then after that, they released it a certain amount of degrees until basically over the next couple of weeks, I think it was like 6 weeks in total, I was able to bend my knee up to 90 degrees. Now, for the first 2 weeks that my knee was completely straight, I could not go into work, so I had another note for that, thankfully again, paid leave. And then what I had to do before I had to go back to work was I spoke with the occupational health department. The occupational health department is someone that you will call or you will go to for basically all of your healthcare needs within your occupation. Sometimes you guys may have gone to see them when you started out in your job because they checked your titers for certain vaccinations, or you know, if you felt unwell otherwise, or if you need any modifications or adjustments to your day-to-day work. So for me, it was that I was now not allowed to be squatting or bending my knee for at least 3 months, and that would be a big problem, especially if there was like a cardiac arrest or somebody collapsed on the ground and I needed to just pick somebody up, or just, you know, do normal things on the ward or walk around and take stairs. So because of that, I spoke to the occupational health GP, and she said, well, tell you what, we'll get you on what's called phased return. So phased return allowed me to work, but on, you know, terms that worked around what I needed, and I wasn't initially working for the full day. So I started off, I started off working 50%, and then that slowly increased over the next couple of weeks until I was back to working 100%. But I wasn't doing any on-calls, so I wasn't doing any night shifts or anything like that, or basically any situation where there would be less people around in case I needed help because I wasn't able to do something on my own. And thankfully, even though I was working reduced hours, the pay stayed as it should have been for me, and that was a really good thing to know, that I wasn't having to worry about a sudden slash in pay just because I had had this accident. So I spoke with the rota coordinators, we got everything fixed and sorted away, and I spent the next couple of weeks trying to get my knee back to where I wanted it to be. Thankfully, I was able to attend a lot of the physiotherapy appointments now physically. I was there present in the hospital because it wasn't too far from where I was working at that time, and we did a lot of exercises once the brace was completely off, especially. Like in the brace, they were more like targeted, limited exercises trying to get the knee strong again, but once it was off, I was trying to walk around, and they gave me resistant bands to use to do a bunch of different exercises to get to that point. So I was seeing them at that time every 2 weeks. I'm currently now seeing them about once a month. I feel like, at least, they haven't told me, but I feel like I'm probably getting to the end of my physiotherapy now, just because I'm starting to do a little bit more that allows me to squat, but not still fully on my own. So it was really good because there was always somebody that I could talk to about, like, I feel like my knee's making a weird noise, or should it be like this, or it's kind of creaky. And they explained to me, well, this is going to happen at this stage, and this is what we're looking for it to be like in this much time. So just keep doing these exercises. So that was really hard for me as a doctor initially to be like, no, I want this to be fixed right now. But then you have to remember, as a patient, you should be patient. And it's hard because you're like, why can't I do these things anymore? What do you mean I have to wait and expect things to get fixed? And it really gives you a good perspective of how when the patient says, you know what, I need to go home right now. I don't care if I am still unwell. You can really sympathize with that aspect of it because you get fed up. You're just like, I want to be back to being able to do what I am used to doing, and I don't want to wait around anymore. So that is the long and the short of it. But now we come to the key bit. How much did this cost me, and how much would this have cost me had I been in the United States?
These are their stories.
Now let's break it all down. So if we first talk about within the NHS, this entire treatment, the surgery, the scans, speaking to the physiotherapists and the consultants, all the appointments I had, was completely covered by the NHS, by the universal healthcare. A lot of you might argue, well, that's not free because you pay taxes. Well, duh, everyone pays taxes. Taxes should be paid. But in the United Kingdom, as part of your taxes, there's something known as the national insurance that you pay, and that is what you contribute towards covering costs for the NHS, for unemployment, for sickness, for benefits, and other things. So everyone is contributing to this one big pot, and whenever somebody needs something, that pot is used to pay for that person's care or for whatever needs that they require. This is in stark contrast to the United States, where you have your own insurance. Either you pay for your insurance or your employer will pay for your insurance. And whether or not your employer will cover just you or your family as well is often something that will vary. But let's just look at it from a very, unadulterated, pure view, that this is how much this would have cost me if this happened to me in my hometown of Houston, and what that potential cost would have been like. I'm not looking at it if somebody has insurance, because the type of insurance coverage you have would vary from person to person. The type of deductible that you have would vary from person to person, and there are too many other little factors that you would have to weigh in. Even the costs that I'm talking about are a bit of an estimate and are pretty generalized, just because the way that the healthcare system is in the US, if you can negotiate, you might be able to get yourself a better rate. And of course, from city to city, from state to state, these costs can depend. So what I've done is I've tried to find average costs within the city of Houston for all of these services. So the cost of an ambulance in the United States would have cost me $1,500. Now that I had gotten from the ambulance to the emergency department, that would have cost me about $1,000. Having an x-ray done would have cost me about $120. And I forgot to mention this earlier, but I actually had to go to ED again because I had a little bit of a snag once I got home. So a second ED visit would have cost me another $1,000. I had an inpatient stay, which means I would be looking at about $3,500. Because I had to have several appointments with a physiotherapist, physiotherapists typically charge about $50 an hour. I want to say I probably, up until now, have had about 20 appointments with the physiotherapists, so there's another $1,000, not to mention how many more I may have after this. Then the actual MRI. The MRI cost can really vary because it's open in a negotiation, and it may be a little bit less if you pay in cash, but a general average is about $3,000 for an MRI of just the knee. And of course, the actual procedure, the arthroscopy itself, will cost about $8,000. So this is without taxes, just a generalized, this is how much I'm looking at. It's really difficult to know how much point blank, because there's no catalog that you can just go through and be like, oh hey, today I want to get, this bone fixed. How much is that going to cost me? A lot of hospitals are open to negotiations, so you can then see, oh, well, if I can't pay all this now, how much can I pay off in this much time or whatever. But effectively, you would be looking at a pretty hefty bill that you would then have weighing you down on your shoulders, thinking about when would I pay off this debt. And a lot of times for a lot of Americans, that debt would not be able to be paid off. They have to declare bankruptcy because it's a really terrible thing that's happened that's required multiple hospital stays, maybe prolonged treatment, and they're looking at hundreds of thousands to millions of dollars of healthcare fees. So a lot of times when people ask me, Ibreez, why would you move to the NHS? Why would you leave the United States and move to the United Kingdom? This is a pretty big factor into all of that. And yeah, sure, a lot of people used to tell me, well, Ibreez, you're otherwise fit and healthy. Why do you need to worry about healthcare? And this is that situation. I would never have expected that I would have gotten to a situation where I would need surgery on my knee, but it happened. And had it happened in the US, even with the insurance, I would have had a pretty high deductible, which, and I don't want to get too much into this, what basically means is if you're otherwise fit and healthy, you don't usually put a low deductible or how much you expect your hospital bill to be before your insurance kicks in, because if you're not going to the hospital very often and if you don't need regular checkups, you're going to want to have a low premium. That means a low amount of money you'll be paying every month, so you leave it for a very high deductible, which means if ever, God forbid, a situation would arise where you became very ill or got into an accident, that would be a huge bill, and that means you would meet your deductible, and the insurance company would then be like, all right, here's what we'll cover, here's what you have to look at. But that, I don't think necessarily would have been the case for me in this situation. It's difficult to say, obviously, because I'm not in that exact situation, but if you think about what your cost could potentially be if you're in a situation where you need to be in the hospital in the US, it is something that you would stress about. Not to mention the fact that I got paid sick leave and had a phased return where I did not have to worry at any moment how much I would be looking at every month because I was still getting my normal pay, and everyone was very supportive and helpful along the way. I also want to make very clear that if you are the only person in your family that's working in the UK, so let's just say it's just you're working in the NHS, and your spouse and your kids are not. So your spouse and your children are your dependents. They would still be able to get free NHS service. So you don't have to worry about having a separate insurance for them, and they are completely covered. So that is also a really big reason, especially for individuals who may think, well, kids will be kids. They will get sick. They may need to be hospitalized. How much of a cost am I looking at? To sum this up, guys, I love being an American. I love everything about America, but the one thing that never sits right with me is the American healthcare system. A for-profit system which is neither helpful for the doctors nor for the patients involved is not good for anyone in the long run. It shouldn't be that in this day and age, a basic human right of just being able to say, do you know what, I don't feel well and I need to get this checked out, should be first thought about, but do I have enough money to cover that? And it's really something that the NHS is out there, and there are other wonderful forms of universal healthcare that are shining examples of how we could be better people if we just thought about the importance of providing that care to everyone involved. And that is me on my soapbox, but I hope you guys have understood how important it is to really understand what you're getting into when you're planning for your future, and to understand that situations may arise sometimes you would never have thought would happen. Like I said, I never thought I would ever be admitted in the hospital at this stage of my life. And I hope I never have to be again, but it does mean a lot to me to know that if something terrible were to occur, the last thing on my mind would be money.